And with me are Fallon and her doctor, Dr. Constantino Mendieta, from no less Miami Beach, South Beach. I mean, and this is what women want, what people want.
I got to tell you,
Miami.
It's sweeping really America, honestly, not only here, but internationally. People are flying in from all over the world to get this done. And the Brazilian buttock is just about adding fat and making the buttock bigger. But the Miami Thong lift, it's much bigger than that. It's about really evaluating the entire buttock. It's about reshaping, resculpting, recontouring. So essentially, many times patients will have a little bit of excess in the lower part of the buttock area, and it gives it a dirty diaper look. So the Miami Thong lift will put a little scar inside of the crease, right down the center of San Andreas Fault. And what that'll do is it allows me to suction that area. That skin will sometimes retract, but sometimes it doesn't. So sometimes I got to put a little scar that goes right down the center area. And even though it's in an area where there's a whole lot of shaking going on, that scar tends to heal pretty darn well.
So you're getting some tightening, and then, of course, volume is a big part of it.
Volume is a huge part of it.
And we want to get into that in 1 second. Let's remind everybody how our patient looked before surgery. We're going to compare that with how she looks now. So this is a result that has lasted. We also want to show this in profile. So let's take a look at how she looked from the side. Nice. So tell us, I mean, a big part of this was the volume that you put in. So tell us exactly how much you put in.
Well, in Fallon's case, when she first presented, she had very little fat, so I had to send her to booty camp. That means that they got to really get...
So you're telling people that you need more fat to gain?
She actually gained about 20 pounds, really, to get the procedure done. And then what we did is we ended up placing almost 800 cc's into each buttock. 800 cc's is about 1.5 pounds of booty.
I want you to turn around again. Wow. I want you to hold those up next to each one of these.
Here we go, Ray. I don't want to spill any of her fat.
And you showed how we do that now with fine needles. I mean, think about it. So it's taking fat from one part of the body and putting it in those parts of the buttock where you want to shape and lift.
And is this something that will now last forever? Obviously, it's her own fat, but is it... Or is this something that will have to be reshaped in the future?
If I can get that fat cell to survive, and it takes about 3 to 6 months for that to happen, but if it does survive, then that fat cell should live for however long it's destined to live. In my opinion, it's destined to live forever because these are areas that we could never get rid of. Love handles, lower belly. As we age, it gets worse. It doesn't get better.
So it's taking the fat from one area and put it where we want it.
So
that's exactly right.
The Miami Thong lift. Thank you so very much for showing it to us today. Fallon, thanks for being here. Appreciate it.